Hello everyone, this is Sharon Tash and I'd like to introduce you to Dr. Sandra Aristodemo, one of the owners of Aristo Dental in Wheeling, Illinois. And Dr. Sandra, can you tell us a little bit about your practice in Wheeling?
Our practice in Wheeling serves everybody. We try to see everyone from the young patients all the way to our seniors. To accommodate them, we also are here many hours. We start as early as 7 a.m. to accommodate those people who need to go to work. So we've got a 7 o'clock and 8 o'clock appointment that patients can come to. We also are here till 7 p.m. on a few evenings a week. Again, we're trying to accommodate every person who works and doesn't work, and just to practice for the whole family to come to.
And are you taking new patients?
We do. We always take new patients, and we're happy to get referrals from the patients that are already here and that we love.
Very nice. And what ages do you treat?
We start to see kids that are around the age of 3. Given that they're pretty cooperative in the chair for their first visit, we'll continue to see them. Again, if they're more suited to see a pediatric dentist, then we'll refer them. But we do start seeing them at the age of 3, and then we see patients all the way up until 90 plus.
And do you do anything for people who have anxiety?
Actually, we do. I have been trained in oral conscious sedation. So we do something called mild sedation, mild conscious sedation. And it's where I give people a little bit of medication, it's pills, and it helps them just relax. And they're in sort of a sleep mode while I'm doing all of their dentistry. The medication also has a slight amnesia property to it, so you don't remember any of it, which is great because it's the sounds of the drilling that bother people, and it's just going back and remembering all their horrible experiences. So that takes away everything.
Now, do you also do nitrous oxide?
We do nitrous oxide in cases where people don't need a complete sedation. There's nitrous, which just takes the edge off, and we do offer that as well.
And how long have you been practicing?
I have been in practice for 12 years. My husband, who is the other dentist here, Dr. Aristodemo, he's been in practice for 13 years.
And do you do any type of continuing education?
Oh, we do lots of continuing education. The bare minimum that you need in order to continue your license is something like 36 hours every 3 years. One class alone that I took in a year was 160 hours. We take hundreds of hours every year. We're always up to date on all the new things, the new technology, the new practices, new materials. We want to give our patients the best, so we always try to continue learning.
Well, speaking of technology, I understand that the practice is quite up to date. Can you tell us a little bit about that?
Absolutely. One of the main things that we have that's great is something called digital radiography. And that's basically digital x-rays. So the image, after the x-ray is taken, comes up on a computer screen instantaneously. The beauty of this is it actually decreases the amount of radiation by 90% of a conventional x-ray. Now, conventional x-rays, just so you know, one dental x-ray is as much radiation exposure as if you walk outside in the sun for 2 minutes. 2 minutes. So it decreases that. It's amazing. We also offer laser therapy for hygiene, and that keeps patients away from having to see the periodontist. So it works wonders. We have computers in every room. We're a paperless office. We're also on our way to being green. We try to limit the amount of papers that we print out and just try to conserve. So lots of computers.
So Aristo Dental is getting to be a sustainable office.
We are.
That's nice. Do you have any expertise in other areas in general dentistry? Everyone knows what a general dentist does, but what do you do beyond general dentistry?
Beyond general dentistry, a couple of my favorite things to do are actually extractions and implants. After I finished dental school, I went on for another 10 months to do an externship in oral surgery. So I spent the entire time working side by side with oral surgeons. So I extract a lot of teeth. That's something that I love being able to offer my patients so that they don't have to go see an oral surgeon. We get to keep it in-house. If it's broken, I can take it out. If it's fully decayed, if it's partially hidden underneath the gums, I can take it out. So I'm glad to offer that. The other thing that I do and enjoy very much is placing dental implants. I received a fellowship in implant placement and implantology in 2010, And I love it. I've taken many, many hours in placing implants. I've been placing them since 2005. And it's a wonderful thing. It's a wonderful standard of care for patients, and I'm happy to be able to offer it to people.
And what does your husband offer?
My husband, on the other hand, deals a lot with the cosmetic aspects of dentistry. So he's into the beautification of the mouth. He does Invisalign, which is clear braces. That's a really great thing for teenagers, responsible teenagers, and adults. The other thing that he really enjoys doing is cosmetic dental work. He is he's Las Vegas Institute trained, which is a very reputable cosmetic institute in dentistry, and he's actually taken that a step further, and he's starting to do Botox and Juvederm. So he's really focusing on the full facial aesthetics of a person.
That's so nice to offer your patients more than just general dentistry.
Yeah.
Now, do you accept any type of dental insurance?
Yes, we accept almost every PPO. And there's several out there. I couldn't even begin to name all of them, but any big major PPO we accept and we're in partnership with.
And do you accept credit cards?
Absolutely. Any credit card, American Express, Visa, MasterCard. We even offer third-party financing called Chase and Care Credit.
And finally, what do you do for people who do not have dental benefits provided by their employer?
That's been a big issue in these past few years with the economy that we have. And so what we have decided to do is we have decided to offer our patients who do not have dental insurance a preferred provider dental plan. And what we do with that is you pay a certain amount of money per year, and with that small fee you get 2 doctor exams, 2 hygiene visits, fluoride, the x-rays that are needed for those visits, and beyond that, any procedure that you might need is 30% off across the board. So it's a really huge savings. It almost gives them the same opportunity as people who do have insurance, but they're not offered it through their employers.
That's very nice. It seems that you and Dr. Giovanni are really looking out for your patients and any future patients that you may have.
Yeah, we do. It's like a family.
It is, definitely. And can you tell us where you're located again, Doctor?
We're located right on Dundee Road. The address is 1205 West Dundee. We are right at the southwest corner of Dundee and Schoenbeck Road, and there's a Walgreens right across the street.
Very good. Well, I appreciate you taking the time today, and we hope everyone comes and visits you.
Thanks.